urologist, and today I want to address a question that's everywhere online and quietly worrying a lot of men. Is Ozempic Penis real? You may have heard claims that medications like Ozempic shrink penis size, damage blood flow, or permanently affect sexual performance. That sounds alarming, and it's exactly why we need to separate viral headlines from medical truth. Here's the hook. What most people think is loss is often actually a change in perception, health, and confidence, not anatomy. Let's address this head on because the phrase Ozempic penis sounds scary, misleading, and frankly louder than the science behind it. There is no medical or scientific evidence showing that Ozempic or other GLP-1 weight loss medications cause the penis to physically shrink. Penis size is determined by anatomy, blood vessels, smooth muscle tissue, and nerve supply, none of which are destroyed, reduced, or damaged by these medications. The idea that a drug designed to improve blood sugar control and metabolic health would selectively cause penile shrinkage simply does not align with how the human body works. What's happening instead is a mix of perception, rapid body changes, and internet fear culture. When men lose weight, especially significant weight, the body changes in ways that can feel unfamiliar. Fat loss around the lower abdomen and pubic area can change how the penis appears at rest. For some men, this actually makes the penis look longer and more exposed because excess fat that previously buried part of the shaft is reduced. For others, changes in posture, skin elasticity, or muscle tone can alter perception. But perception is not reality. A mirror, lighting, anxiety, and expectations all influence how size is judged, especially when someone is already worried something might be wrong. Another factor is erections, not size. During weight loss, some men notice erections that feel different, less rigid at certain times, or less frequent temporarily. This does not mean tissue loss. Erections depend heavily on energy balance, sleep, hydration, stress levels, and hormones. Rapid weight loss can temporarily affect testosterone levels, particularly if calorie intake is very low or protein intake is insufficient. Fatigue alone can blunt sexual response. None of this equals permanent damage, and none of it means the penis is shrinking. It means the body is adjusting. Blood flow is another major misconception. Ozempic does not reduce blood flow to the penis. In fact, poor blood flow is most commonly caused by diabetes, obesity, high blood pressure, smoking, and high cholesterol. These are the same conditions Ozempic is often prescribed to help manage. Over time, improving insulin sensitivity, reducing inflammation, and lowering cardiovascular risk can actually improve erectile function, not worsen it. If erections improve months after weight stabilization, that's usually the result of better vascular health, not coincidence. Then there's the psychological side, which is often underestimated. When men hear alarming phrases online, especially about sexual health, it creates fear. Fear activates stress hormones, and stress is one of the strongest erection killers we know. Worrying about size or performance can lead to hyperfocus, self-checking, and anxiety during intimacy. That anxiety can cause erection changes, which then confirm the fear, even though nothing physical is wrong. This feedback loop is powerful, and it spreads faster than facts on social media. It's also important to remember that correlation is not causation. Many men start Ozempic during a period when they're already dealing with metabolic disease, fatigue, low testosterone, or erectile dysfunction. When sexual concerns show up around the same time as a new medication, the medication gets blamed, even if the root cause existed long before. That's why proper medical evaluation matters. A urologist looks at hormones, circulation, sleep, mental health, and medications together, not in isolation. So the bottom line is this: Ozempic penis is not a real medical condition. It's a viral label applied to normal, temporary, or unrelated changes that happen during weight loss and lifestyle shifts. The penis is not shrinking, blood flow is not being destroyed, and sexual health is not being sacrificed by improving metabolic health. In fact, long-term sexual function is far more likely to benefit from better weight control, improved blood sugar, and cardiovascular health. When you understand the science, the fear loses its power and confidence starts to return. One of the most common misunderstandings fueling fear around weight loss medications is the belief that a change in how the penis looks must mean a change in its actual size. In reality, perceived size changes are almost always about visibility, not anatomy. The physical structure of the penis does not shrink because of fat loss, medications, or lifestyle changes. What changes is the surrounding body, and that can dramatically alter how the penis appears, especially to the person looking at it with heightened awareness and concern. A large portion of the penis is not visible externally. The shaft extends back toward the pelvis, and the area at the base is surrounded by subcutaneous fat. When men carry extra weight, especially in the lower abdomen and pubic region, that fat can partially conceal the base of the penis. This is why some men with obesity experience what's called a buried penis appearance, even though the penis itself is completely normal in size. As weight is lost, that fat pad decreases. In many cases, more of the shaft becomes visible, making the penis appear longer. But during rapid body changes, perception doesn't always match reality, especially when expectations are shaped by fear or online misinformation. Another important factor is posture and body mechanics. Weight loss changes how a man stands, sits, and moves. Pelvic tilt, abdominal tension, and muscle engagement all influence how the penis rests against the body when flaccid. A different resting position can make the penis look shorter or longer at different times of the day, even though nothing structural has changed. Temperature, stress, and physical activity also affect flaccid length, which naturally fluctuates and is not a reliable indicator of true size. Skin changes also play a role. Rapid weight loss can temporarily reduce skin elasticity, leading to looser skin around the lower abdomen and groin. This can create shadows, folds, or angles that change how the penis appears in the mirror. For someone already anxious, these visual changes can be misinterpreted as shrinkage. Over time, as weight stabilizes and the body adapts, skin tone and appearance often improve, and these visual distortions become less noticeable. Erections further complicate perception. If erections feel less firm during a period of calorie restriction, fatigue, or stress, men may assume the penis itself is smaller. But firmness is about blood flow and arousal, not tissue loss. Even small variations in rigidity can affect how long or full the penis looks during erection. That doesn't mean size has changed. It means the physiological conditions for an optimal erection aren't always perfectly aligned during periods of transition. The brain plays a powerful role in how size is perceived. When a man is told repeatedly that a medication might shrink his penis, he starts checking. He compares, measures, analyzes angles, and remembers how things used to look. Memory, however, is not objective. Anxiety sharpens focus on perceived flaws while ignoring normal variation. This heightened self-monitoring can convince someone something is wrong, even when nothing has changed anatomically. It's also important to understand that true penile shrinkage is rare and typically associated with very specific medical conditions, such as severe untreated erectile dysfunction, advanced vascular disease, pelvic surgery, or prolonged lack of erections over many years. Weight loss medications do not cause these conditions. Losing fat does not remove penile tissue. Anatomy does not disappear because body composition improves. Ultimately, what men are seeing is not loss, but transition. The body is changing, the mind is adjusting, and perception is catching up to a new physical reality. When fear is removed from the equation and health stabilizes, most men find that their concerns about size fade. What remains is often improved energy, better circulation, and greater confidence, things that matter far more for sexual health than what the mirror seems to show in a moment of doubt. One of the most persistent fears surrounding Ozempic and similar medications is the idea that they somehow reduce blood flow to the penis, leading to weaker erections or long-term sexual damage. From a medical standpoint, this concern does not hold up. Ozempic does not constrict penile blood vessels, damage arteries, or interfere with the physiological process required for erections. In fact, when we look at how erections actually work and what truly disrupts blood flow, the narrative becomes much clearer and far less alarming. An erection is a vascular event. It depends on healthy arteries delivering blood into the penis, smooth muscle relaxation allowing the erectile chambers to fill, and veins compressing to trap that blood inside. Anything that interferes with this process, such as diabetes, high blood pressure, smoking, obesity, or high cholesterol, can impair erectile function. These conditions damage the lining of blood vessels over time, making it harder for blood to flow efficiently. Ozempic is commonly prescribed precisely because it helps manage these underlying problems, not because it worsens them. Ozempic belongs to a class of medications called GLP-1 receptor agonists. These drugs improve insulin sensitivity, lower blood sugar, reduce inflammation, and support weight loss. All of these effects are beneficial for the cardiovascular system. Better blood sugar control reduces damage to blood vessels. Lower inflammation improves endothelial function, which is critical for healthy erections. Weight loss decreases strain on the heart and improves circulation throughout the body, including the pelvis. From a vascular perspective, these changes are protective, not harmful. Some men may notice changes in erections shortly after starting Ozempic, but timing does not equal cause. Early in treatment, people often eat fewer calories, feel more fatigued, or experience gastrointestinal side effects. Fatigue and reduced energy alone can decrease sexual desire and arousal. Erections are sensitive to overall physical state. When the body is adjusting to a new medication or a significant calorie deficit, sexual function may temporarily take a back seat. This is not a blood flow problem. It's a prioritization issue within the body. Hydration also plays a role. Reduced appetite sometimes leads to reduced fluid intake, and dehydration can affect blood volume and circulation. This can make erections feel less robust at times. Once hydration, nutrition, and energy levels stabilize, erectile function often returns to baseline or improves. Again, this is a temporary physiological response, not vascular damage. Another key factor is stress. Fear-driven narratives about sexual side effects create anxiety, and anxiety directly interferes with erections through the nervous system. When the brain perceives a threat, even an imagined one, it activates the stress response, which diverts blood away from non-essential functions like sexual arousal. This CA and mimic the experience of poor blood flow, even though the blood vessels themselves are perfectly healthy. It's also important to consider the bigger picture. Erectile dysfunction is often an early warning sign of cardiovascular disease. Improving metabolic health reduces long-term risk to both heart and penile blood vessels. Men who lose weight, control blood sugar, and improve cholesterol often experience better erections over time. Numerous studies show that lifestyle improvements and metabolic control are associated with improved erectile function, not decline. If a man experiences persistent erectile difficulties while on Ozempic, it should not be assumed that the medication is reducing penile blood flow. A proper evaluation looks at testosterone levels, sleep quality, mental health, vascular health, and other medications. Often, the issue existed before treatment or is related to factors that can be addressed. The key takeaway is simple and reassuring. Ozempic does not block, damage, or reduce blood flow to the penis. On the contrary, by improving the very conditions that impair circulation, it can support long-term sexual health. When fear is replaced with understanding, men can focus on what truly matters, building a healthier body that supports strong blood flow, better erections, and greater overall confidence. When men notice changes in sexual function during weight loss or after starting a new medication like Ozempic, it's natural to assume the medication is the cause. But in many cases, these changes are temporary and driven by factors that have nothing to do with permanent damage, anatomy, or blood flow. The body is highly adaptive, and during periods of transition, it often shifts priorities. Sexual function can fluctuate as part of that adjustment, especially when multiple physiological systems are changing at once. One of the most common reasons for temporary changes is calorie restriction. When calorie intake drops significantly, the body conserves energy for essential functions. Reproduction and sexual performance are not considered survival priorities in times of perceived energy scarcity. This doesn't mean something is wrong, it means the body is responding appropriately. Reduced caloric intake can lead to lower libido, fewer spontaneous erections, or erections that feel less firm for a period of time. Once calorie intake stabilizes and nutritional needs are met, sexual function often rebounds. Fatigue is another major factor. Weight loss, especially when it happens quickly, can leave people feeling physically drained. Fatigue directly affects sexual desire and performance. Erections require a coordinated response between the brain, nervous system, hormones, and blood vessels. When the body is exhausted, that response may be blunted. This is especially common in the early weeks of treatment, when appetite changes and energy levels haven't yet normalized. Hormonal fluctuations also play a role. Rapid weight loss can temporarily affect testosterone levels, particularly if protein intake is inadequate or if the body is under stress. Testosterone is important for libido and erectile quality, but short-term dips do not mean permanent hormone loss. As the body adapts, hormone levels often stabilize or even improve, especially as insulin resistance decreases and overall metabolic health improves. Hydration is another overlooked factor. Reduced appetite often leads to reduced fluid intake. Mild dehydration can decrease blood volume and contribute to erections that feel less full. This effect is reversible and resolves with adequate hydration. Similarly, electrolyte imbalances, especially during early weight loss, can affect muscle and nerve function, which may subtly influence sexual response. Sleep disruptio. N is also common during lifestyle changes. Poor sleep negatively impacts testosterone production, energy, mood, and sexual performance. Even a few weeks of inadequate sleep can lead to noticeable changes in libido and erections. Improving sleep quality often leads to rapid improvement in sexual function without any other intervention. Psychological factors cannot be ignored. Anxiety, fear, and constant self-monitoring can create a feedback loop that interferes with normal sexual response. When men worry about whether something is wrong, they become hyper-focused on performance. This activates the stress response, which directly opposes the relaxation required for erections. The more attention placed on the problem, the more pronounced it can feel, even in the absence of a physical cause. It's also important to understand that erections naturally fluctuate. They are influenced by time of day, stress, mood, and physical health. Temporary changes are a normal part of life and do not signal permanent dysfunction. True structural or vascular problems develop gradually and persist, not appear suddenly during a period of change. The most important takeaway is reassurance. Temporary changes during weight loss or medication adjustment are common, expected, and reversible. They do not mean the penis is damaged, shrinking, or losing blood supply. As nutrition, energy levels, sleep, and confidence stabilize, sexual function typically returns or improves. Understanding this helps reduce fear, which itself is one of the biggest obstacles to healthy sexual performance. Sexual performance is not just a physical process. It is deeply influenced by the mind, and confidence plays a central role in how the body responds during intimacy. Even when anatomy, hormones, and blood flow are perfectly healthy, a lack of confidence can interfere with arousal, erections, and satisfaction. This is especially important during periods of physical change, such as weight loss or starting a new medication, when self-image and expectations may feel unsettled. Confidence affects sexual performance through the nervous system. For an erection to occur, the body needs to be in a relaxed parasympathetic state, often described as rest and arouse. Confidence helps create that state. When a man feels secure in his body and his ability to perform, the brain sends clear signals that allow blood vessels to relax and fill the erectile tissue. Anxiety, self-doubt, or fear do the opposite. They activate the stress response, releasing adrenaline, which tightens blood vessels and suppresses arousal. This can happen even if physical health is excellent. Body image changes can strongly influence confidence. Weight loss alters how the body looks and feels, sometimes faster than the mind can adjust. Loose skin, changes in fat distribution, or simply seeing a different body in the mirror can create uncertainty. Instead of focusing on improved health or energy, some men fixate on perceived flaws. This hyper-awareness can spill into sexual situations where attention shifts away from pleasure and connection and towards self-monitoring. When performance becomes something to check rather than experience, confidence erodes. Misinformation also plays a powerful role. Hearing alarming claims online about sexual side effects can plant doubt, even in men who had no concerns before. Once that doubt exists, it can change expectations. Expectation alone can shape sexual response. If a man expects difficulty, the brain prepares for it, increasing tension and reducing arousal. This is not imagined. It is a real physiological response driven by the mind. Over time, repeated experiences of worry can create a pattern that feels physical, even though it began psychologically. Past experiences also influence confidence. A single episode of erectile difficulty, especially during a stressful period, can leave a lasting impression. The next sexual encounter may be approached with fear of recurrence. That fear increases the likelihood of the same outcome, reinforcing the belief that something is wrong. This cycle can continue until confidence is restored and fear is addressed. Confidence is also tied to emotional safety and communication, feeling accepted by a partner, free from judgment, and able to talk openly about concerns reduce pressure. When men feel they must perform or meet a certain standard, confidence drops. When intimacy is viewed as connection rather than performance, the body responds more naturally. The good news is that confidence is not fixed. It can be rebuilt. Understanding that temporary changes are normal, that health improvements support sexual function, and that the body is not broken can relieve much of the anxiety. As men feel stronger, healthier, and more in control of their overall well-being, confidence often returns. With it comes improved sexual response. Ultimately, sexual performance is the result of both physical readiness and mental ease. Confidence bridges the gap between the two. When fear and self-doubt are removed, the body often does exactly what it is designed to do, naturally, reliably, and without force. While temporary changes in sexual function are common during periods of weight loss, stress, or lifestyle transition, persistent symptoms are different and deserve proper medical attention. When issues such as ongoing erectile dysfunction, reduced libido, difficulty maintaining erections, or changes in ejaculation continue for weeks or months, they should not be dismissed, ignored, or automatically blamed on a medication. Persistent symptoms are the body's way of signaling that something deeper may need evaluation, and addressing them early can prevent long-term complications. Sexual function is closely linked to overall health. The penis is often described as a barometer of vascular and hormonal well-being because erectile tissue is highly sensitive to changes in blood flow and nerve function. When erections are consistently impaired, it may be an early sign of conditions such as cardiovascular disease, diabetes-related nerve damage, hormonal imbalances, or chronic stress. These issues can develop silently long before more obvious symptoms appear. Ignoring persistent sexual symptoms means potentially overlooking important health warnings. A medical evaluation does not start with assumptions. It starts with understanding the whole picture. A urologist or qualified healthcare provider will review medical history, medications, lifestyle factors, sleep patterns, and mental health. Blood tests may be used to assess testosterone levels, blood sugar control, cholesterol, and other markers that influence sexual function. This comprehensive approach helps identify whether the issue is hormonal, vascular, neurological, psychological, or a combination of factors. Hormonal imbalances are a common but often misunderstood cause of persistent symptoms. Low testosterone can affect libido, erection quality, energy levels, and mood. Weight changes, aging, poor sleep, and chronic illness can all influence hormone levels. Identifying and treating hormonal issues can significantly improve sexual health and overall well-being. Importantly, treatment is individualized. There is no one-size-fits-all solution. Vascular health is another critical area. Erections require healthy blood vessels, and persistent erectile dysfunction may indicate reduced blood flow due to atherosclerosis or endothelial dysfunction. Addressing these issues early not only improves sexual function, but also reduces the risk of heart attack and stroke. In this way, seeking help for sexual symptoms can be life-saving, not just quality of life improving. Mental health should never be overlooked. Anxiety, depression, chronic stress, and performance-related fear can all contribute to ongoing sexual difficulties. Even when physical health is good, unresolved psychological factors can maintain symptoms. A medical evaluation helps distinguish between physical and psychological contributors, ensuring that treatment targets the true cause rather than just the symptoms. It's also important to avoid self-diagnosis or reliance on online information. Internet narratives often oversimplify complex medical issues, leading men to delay care or blame the wrong factor. Medications like Ozempic are frequently accused when the real cause may be pre-existing conditions or lifestyle factors. A healthcare professional can clarify these distinctions and provide evidence-based guidance. Perhaps most importantly, seeking medical evaluation removes shame from the conversation. Sexual health is health. Persistent symptoms are not a personal failure or something to be endured silently. Effective treatments exist, ranging from lifestyle changes and counseling to medications and targeted therapies. The earlier evaluation begins, the more options are available. Taking persistent symptoms seriously empowers men to protect both their sexual function and their long-term health. Rather than living with uncertainty or fear, medical evaluation offers clarity, reassurance, and a path forward. Grounded science, not speculation. So, is Ozempic penis real? No, there is no evidence of permanent size loss or damaged blood flow. What is real is the impact of weight loss on perception, confidence, and overall health. The takeaway is simple. Improving your metabolic health is one of the best things you can do for your sexual health. Don't let myths steal your confidence or distract you from the bigger win, living healthier, longer, and stronger. I'm Dr. Rena Malik, and when it comes to your body, always choose science over fear.